I would like to first say that we thank Dr. Ace. Am I pronouncing it correctly?
Aase, that's okay.
Aase, thank you for doing this. He will be discussing decision making and cognitive process among protective firearm owners. And Dr. Aase, you may begin.
Wonderful. Thank you so much. Um, Hopefully, I'm doing this all correctly. So, thanks for coming, everybody.
Perfect.
My name is Darrin Aase. I'm an associate professor at the Ohio State University at the Wexner Medical Center, working within the Department of Psychiatry and Behavioral Health. And we're here to present about the work that we've been doing with the funding from the New Jersey Gun Violence Research Center. The title of our project is Decision Making and Cognitive Processes Among Protective Firearm Owners. And I'm going to just dive in. So first of all, though, before we get into the project, I wanted to acknowledge that I'm not doing this alone. I'm working with another principal investigator on this study, who's Dr. Craig Bryan, who's very well known in this area of research. He's my colleague at the Ohio State University, and he's the stress, trauma, and resilience professor, and he directs the Division of Recovery and Resilience at the medical center. And he's just a couple of offices down from me, but he was unable to be here today. So you have me instead presenting this project, and I've already introduced myself. I am the co-director of the neurobehavior program at the Ohio State University. And specifically, my specialty is neuropsychology. So I see patients and do a lot of cognitive assessment. And my area of research is focused predominantly on addiction and on trauma. And working with Craig, we've been talking a lot about how we can use cognitive tools to try to assess and figure out if we can come up with some ways to improve upon suicide risk interventions. This work is supported in part with funding provided by the New Jersey Gun Violence Research Center at Rutgers University. The Gun Violence Research Center works in collaboration with and is supported by New Jersey's Office of the Secretary of Higher Education. So, first off, just to paint a broad picture of what we're trying to do at Ohio State here right now, is this project is about helping to further explore how factors related to owning firearms might interact with personal factors. So things like how we feel, how we think, how do we go about making decisions, how impulsive could we be, and seeing if some of those factors would predict suicide risk. This isn't completely new territory. We are building on things that have already been established to try to add some new ways of measuring these personal factors to zero in on what domains could be intervened upon. And that's our hope, is that what we find will help guide interventions focused on reducing firearm mortalities. I have this visual here because there's some concepts that we're really focused on. So when you think about firearm acquisition and ownership, we want to think about both affective or like emotional and cognitive processes. It's already been known that there's sort of two different ways that owning firearms and wanting to acquire more firearms is reinforced. One way on the left side of the screen is when there are firearm owners that have exaggerated threat expectancies. That ends up being kind of that through that negative affective pathway, it reinforces people's desire to acquire firearms, for the purpose of protection. And also, firearm acquisition and ownership also can give people an increased sense of perceived power and control. And so through that, and that makes people feel better. And so through that positive affective pathway, it can also lead to be predictive of firearm acquisition and ownership. So some of the recent studies of firearm owners have suggested that there are a couple of really important variables that we should be paying attention to when we're thinking about suicide risk. First of all, owning a firearm for the purpose of protection, we'll call this like being a protective owner or protective ownership, and also intending to acquire a firearm within the next year are associated with having heightened threat expectancies. And these heightened threat expectancies can represent a cognitive affective process that could be increasing people's suicide risk vulnerability. And in particular, the combination of these two things, this intent to acquire more firearms, and also this this protective reason for owning a firearm, is associated with higher recent suicidal thoughts and behaviors. So if you take a look at this recent study from 2020, this takes a look at on the left, like vertical axis, we have suicidal behaviors, and on the right we have the yes or no question of whether or not they're intending to acquire a new firearm. And then the different colored shadings of the bars on the bar graph represent whether you are a non-gun owner, a non-protective gun owner, which would mean owning a firearm for a different purpose, for recreational things, or as a family heirloom, or other reasons for owning, or are you a protective gun owner? And if you look at that really tall bar right in the middle there, that represents people who are protective gun owners who are intending to acquire another firearm within the next 12 months in terms of having the highest rate of suicide risk. This is an interaction effect that was detected, and kind of says that the combination of those two things really increases the risk. So we have zeroed in on this concept and want to continue to flesh it out a little bit further to understand what's going on here. So when we think about these threat expectancies, that term that I threw out there earlier, you can think about it as, what leads to these exaggerated threat expectancies. And sometimes it could be the overestimation of threat and negative outcomes. Sometimes people have an attentional bias towards threat cues. In particular, in certain populations, like folks who have PTSD often have they tend to pay more attention to threat-related cues. And then also deficits in recognizing like the positive things in somebody's environment, the safety cues. Those all kind of load onto these exaggerated threat expectancies. And what that can do is lead to increased cognitive and behavioral reactivity, and increased behavioral avoidance of threats. And so we're kind of thinking about this increased cognitive and behavioral reactivity component here in this study in terms of what types of cognitive and behavioral processes are happening in relation to these two variables: firearm ownership for protective reasons and intent to acquire more firearms. PTSD is a risk factor for suicide, certainly, as with some other mental health conditions. And the relationship between PTSD and firearm-related variables is a bit complex and nuanced, and it requires further study. Studies evaluating both factors are limited, and we need to better understand how trauma-related variables can interact with the cognitive and affective processes in the context of owning firearms. Individuals who've made a suicide attempt in the past year are also more likely to be sensitive to immediate rewards at the expense of larger delayed rewards. So if we think about like a decision-making style, we all have to make different decisions. If we, and sometimes we definitely want that short-term reward, and we don't want to wait a week for it or a year for it for the larger reward. So we found that people who've made a suicide attempt are more likely to be sensitive to more immediate rewards. And people with PTSD symptoms also demonstrate a similar sensitivity to these immediate rewards. And that sensitivity, which we'll call reward-based decision-making, may reflect a vulnerability for suicidal behavior, possibly related to deficits in cognitive control. And that leads us to really, I think, something that's been missing. And the piece that I've been talking with Craig about adding to some of our research related to these matters is objective measures of cognitive functioning. As a neuropsychologist, typically we bring people into the office and we give them different kinds of measures to test memory, attention, IQ, all sorts of different things. But As our society advances, we've also started to be able to collect some useful, more automated cognitive assessment tools that could be deployed for more of a nationwide study when we can't bring everybody into the office. Things that people can actually complete in their homes over the web or even on an iPad. So for us, we really are interested specifically in cognitive factors that are involved in decision making, things we call executive functioning tasks. So if we are able to measure these in relation to firearm variables, as well as trauma exposure, as well as other measures of affective functioning, things like alcohol use, depression, anxiety, and positive affect and negative affect, and behavioral activation and inhibition, there's really a lot that we can try to tease apart by measuring all of these different domains. So broadly, our overall goal from this study is to measure objective cognitive performance associated with firearm ownership and acquisition in order to elucidate the potential cognitive and affective process disruptions that have been identified in recent studies of firearm owners. So our first aim, if we're going to break this into sort of two subsets of goals, is to really determine our performances on objective executive functioning tasks going to differ in relation to these firearm ownership variables, being a protective owner and intending to own a firearm. And also, we want to see if there are possible associations among cognitive performance, indicators of trauma-related symptoms, and suicide risk as well. If people are more going to make decisions based more on immediate rewards, are there cognitive underlying factors related to this? So we have made some specific predictions based on what we have found in the literature thus far prior to doing this study. And the first is that protective firearm owners will have worse performance on risky decision-making, mental flexibility, and emotional bias tasks relative to non-owners. I'll give you some visuals of what these tasks look like in a moment, but I just wanted to give you a sense for what we're predicting here. So we think that maybe folks who have higher threat sensitivity and exaggerated threat perceptions might end up having some cognitive issues on these mental flexibility tasks, or they might read emotions differently than other people. We also think that people who intend to acquire a firearm in the next month may also perform worse on some of these executive functioning measures that we've been talking about than those who aren't planning on acquiring a firearm. We also are hypothesizing that more trauma exposure and psychological symptoms are going to be correlated with risky decision-making and emotional bias, but negatively correlated with higher mental flexibility. And we also hypothesize that suicide risk will be positively correlated with risky decision-making and emotional bias, but negatively correlated with mental flexibility. So we really want to take a look at these objective indicators in relation to these other variables that have been measured but mostly via self-report. In terms of how we are setting up the broader study, and we're in the process of collecting data still, is we thought that based on some of the demographic and firearm related variables that Dr. Bryan has found in prior studies, we figured that we need to find a big enough pool of folks that we're going to be able to get enough people to test some different cells in our design. If you take a look at the bottom four boxes, these are the groups that we're interested in trying to assess. A protective owner with the intent to acquire a firearm. We want 50 people in that group. A protective owner with no intent of purchasing another firearm. We want 50 people in that group. A non-owner who is intending to purchase a firearm in the next 12 months. And then non-owners with no intent of purchasing any firearms. So in order to get enough people that are going to fill all of those different cells, using statistics from prior studies, we estimated that about 800 people should get us 50 from each category. Then after doing an initial survey, there's a follow-up cognitive assessment that we're doing where we actually have a Zoom call with folks, and we meet with them, and we consent them, and we give them a cognitive test right over Zoom, and then we send them a link, and they complete these objective cognitive measures as well. So you can see this is kind of just visually depicted differently, sort of these two different variables: firearm ownership, protective owner versus non-owner, intent to acquire a firearm in the next year, intent versus no intent. And that's how we end up with these four different groups that we want to run comparisons on these different measures. So the measures that we're utilizing and deploying for this study we're trying to gather a lot of information. So in terms of just demographic variables, we've pulled out items related to firearms from the Behavioral Risk Factors Survey. One second, I'm just seeing. I was just looking at this. I see a question in the chat, and I just want to address this. Yes, there are non-protective gun owners, but for our primary hypotheses, we're just comparing non-owners to protective owners more directly. We will have, in that other group of 600 people, we will have some non-protective gun owners as well, certainly. So just in the data set where we can run certain comparisons on, we will have the non-protective group. It's just we didn't zero in on this group for these specific hypotheses. So from the Behavioral Risk Factor Surveillance Study, we asked people about firearm ownership, and we also asked them about their reasons for having a firearm and what their primary reason is. They have 11 different options, for reasons for having it, and we are really focused on the protective gun owner group, primarily for this analysis. We also have some questionnaires about decision-making style and also subjective cognitive functioning. So the probability discounting questionnaire or the monetary choice questionnaire, it puts people through making decisions on things like, would you rather have $1 today or $11 by Friday? Would you rather have, $2 today or $3 tomorrow? And you get a sense where after a number of different items, the degree to which people are interested in more reward-based decision making. And then also just taking a look at people's subjective cognition in terms of their memory and attention and those sorts of symptoms. We also are going to be measuring a number of PTSD and trauma-related variables. So we're giving the life events checklist for DSM-5. And in this checklist, there is, it lists a number of different traumatic events that people may or may not have been exposed to in their lifetime. Then we're also measuring PTSD symptoms using the PTSD checklist for DSM-5. And looking at the post-traumatic cognitions inventory as well, which gives us a sense for different thought patterns that people might be having, in response to a trauma. For suicide risk, we're looking at self-injurious thoughts and behaviors, and we're also using the suicide cognition scale. And then finally, we want to measure a number of other affective factors that could be influencing somebody's performance potentially. So we're giving the patient health questionnaire, which looks at a number of physical symptoms that people can have, the Generalized Anxiety Disorder 7 or GAD-7, the International Positive and Negative Affect Schedule, the Behavioral Inhibition and Behavioral Activation Scales, and the Alcohol Use Disorders Identification Test. So we want to get information about depression, anxiety, alcohol use, and affect so that can help inform our interpretation of the results.
Well, thank you so much. That was so informative.
Oh, I have a little bit more.
Oh, sorry.
Okay. Then we also have follow-up cognition measures for this other subset. So we're giving these electronic measures from what's called the CANTAB. It's the Cambridge Neuropsychological Test Automated Battery. We can send a web link to participants and they can complete these on their computer. So we're giving a number of tasks looking at decision-making and risk-taking, complex attention and set shifting, which are other executive functions. We're also looking at facial emotion recognition and whether or not people have biases in terms of how they interpret emotions. We're looking at sustained attention, visual spatial working memory, and the auditory verbal working memory from the digit span is another test that we're giving. So this just kind of gives you some visuals about how some of these computerized cognitive tests are. If you're into playing any like online computer or cognitive games, it might feel like a game. It takes about 38 minutes for people to go through the test that we've selected. And then we will be able to capture a number of metrics related to how they perform on these tests. And then to answer the question from the chat earlier a little further, this idea of there being non-protective gun owners, and certainly it's just not what our primary comparison is that we're looking at. But the larger data set will allow for a lot of secondary analysis of other behavioral processes underlying the relationship between firearm ownership and suicide risk. So as we mentioned here, these other group comparisons like non-protective firearm owners, veterans versus non-veterans. We can look at other cognitive domains relevant to trauma exposure. And we can also look at mediational analyses to try to understand the relationship between firearm ownership and acquisition, threat expectancies, affective states, and behavioral motivations. So we'll be able to expand upon what's already been done with a large number of participants so that we can answer other important research questions that are out there. So now I'm done. So data collection is still in progress. We've been moving along at a great clip and continuing to collect this data, but we will look forward to sharing our findings. Appreciate your interest and support, and I'm happy to take any questions, or feel free to use my email to contact me if you have follow-up questions later.
Now can I come in?
Good.
Sorry about that before, but thank you so much for that presentation. It was really, really great. We have a question, which was early on, and it started off with, what is a protective gun owner?
Yeah, so protective gun ownership, the way that we're defining it for the study, is people that own guns for the purpose of protection. That's the reason for owning it, is that I want to have a gun because I want to protect myself or protect my family. That's my primary reason for having a gun.
Okay. And then the second question was, aren't there non-protective gun owners?
Yeah, so I tried to address this kind of during the presentation, but so yes, there are. In our initial survey of 800 people, we certainly are getting folks that are non-protective gun owners. And I would say that our primary reason, we're really interested in seeing if there's a signal cognitively. And so by making the comparison between protective gun owners, who it seems like, and non-owners, it seems like if there's going to be a difference, we're going to probably find it there. In more refined analyses later, we can look at non-protective gun owners as well. But the reason that we zeroed in on this population, I'll go back here, was that really this graph where we found that the combination of being a protective owner and intending to acquire more firearms was really related to the highest risk for suicidal behaviors.
Great. Another question. Do you think that these cognitive and decision-making differences can be altered? And if so, could that be done to scale?
Sorry, I'm trying to think. I was just trying to see if I could find it written somewhere.
No problem. Absolutely.
Sorry, could you repeat the question? I couldn't find it.
Surely. Do you think that these cognitive and decision-making differences can be altered? And if so, could that be done to scale?
So that's a very good question. I think that there are like cognitive rehabilitation types of efforts. It's a complicated question because some of our executive functions are sensitive to things like mental health symptoms, psychiatric symptoms. So like depression and anxiety, those types of things definitely can impact somebody's performance on executive functioning measures. That's part of why we're measuring those things. Mm-hmm. So in theory, treatment of underlying factors could help executive functioning, but there's also cognitive rehabilitation types of interventions that are being developed for all sorts of things. So if people have had a stroke or a brain injury, or other factors, other physical traumas or illnesses, cognitive rehabilitation interventions have been a popular thing to try to improve upon executive functioning. Whether or not that can be done to scale in a mainstream way yet, I think is to be determined. I would not be surprised to see to see a lot of research on that over the next 10 years. But as of right now, I wouldn't say that those interventions are to scale.
Now we have another question, and they're coming in hot, so be ready. Um, Claire said, I'm really interested in your earlier remarks about executive function as being a factor in suicide risk. Is there research you know of in terms of interventions of increasing development of EF among gun owners?
So that's part of why we're doing this study, is to see if there is anything like this. So I have not seen any research to date that is looking at that directly. I think that's part of why we're doing this study, is to see, does it appear to be a factor, and is it something that people should focus on in terms of interventions?
And another one is, so could the heightened threat expectancy also be correlated with IPV or harming others with a gun?
Heightened threat expectancy. Yeah, certainly. I mean, I think you can think of, it's probably correlated in some ways. You can think of increased threat expectancies. I think for us, part of why we're measuring trauma in this is that there's different ways to think about it. There could be some people who are just more sensitive to threat to begin with, that might have this as just like a general risk factor. But then there's other people for whom it may have been more acquired through a traumatic experience. And the thought is that, go back to this slide here. The thought is that some of these expectancies, but through means of negative affect, like impact firearm variables. So I think it's quite possible that they could be associated with some of these other concepts that you're talking about. I don't have any data right in front of me to answer that directly, though.
Oh, well, either way, they said that you answered their question, so that's great. So we thank you, Darrin, for your presentation.